everybody. I'm Dr. Marianne Pinkston, and welcome to The Better Life with Dr. Pinkston. I am here to bring you Dr. Carlos Duncker today from Pinnacle Research. He has joined us before, but we are going to expand our topic today on fatty liver and fatty liver research because of the enormity of the problem, not only in South Texas, but Southern America, but all over the United States and now all over the world. Pinnacle Research has been with me for 2 years now as a sponsor, and I have found it very important to get them involved because that is something that I have suffered from in the past is fatty liver. And it opened my eyes to the fact that we do not have a lot of treatments, but we also have a very, very little knowledge base on how important this disease is and why it's taking kind of a back seat to things like cardiovascular disease, hypertension, diabetes, whatnot. All these diseases are involved together, and Dr. Duncker is here with me today again to discuss this important topic. Welcome in again, and I'm happy to see you.
Thank you. Likewise.
Well, and I know in the past we talked a little bit about the problem of fatty liver and why it's important that we get this diagnosed. And it opened people's eyes now to the fact that it is a part of the whole metabolic inflammatory, chain of events that are killing Americans. And so how big is this problem? Define fatty liver for us, and how big is this problem?
Sure. So fatty liver is a disease that affects populations all over the world. There are hundreds of millions of people that have a fatty liver. In the US, the prevalence of this disease is extraordinarily high. It's really, really bad. Probably about 40% of the population may have some sort of fatty liver disease. And maybe about 40% of those will have the most serious side of this disease, which is that where some fibrotic, some scar tissue is already being produced in the liver that may end up on patients getting cirrhosis, getting liver cancer, requiring a liver transplant, or even dying of complications of the disease.
Right.
I'm sorry. In the valley, the prevalence of this disease is among the highest in the US. So this may be linked to nutrition, to the diet. It may be linked to some genes. The Hispanic population, especially the Mexican population, has a gene known as PNPLA3 that makes the fat already stored in the liver very difficult for it to get out of the liver, so it just keeps accumulating. And then on top of that, we are used to having a lot of sugars and carbohydrates, such as, the Mexican Coke and all that stuff, and the flour tortillas, right? All of that is carbs that facilitate the accumulation of this fat in the liver that keeps increasing until it produces some inflammation that will in turn trigger the production of fibrosis with all the complications that I just mentioned.
Yes.
Also, on top of all of that, the prevalence, the incidence of cirrhosis and liver cancer in the valley is the highest in the United States. And recently I found out that Alzheimer's disease, which, as you mentioned on the previous show, is also linked to this pro-inflammatory state of people with this metabolic syndrome, is the highest in the US also. So there's a lot to do and a lot of concern about these populations. And that's why it makes me really, really happy to be able to offer something for this population in need in the Valley.
Absolutely. And the reason I almost interrupted you a moment ago is because it came to mind when I think of, and in the past, when I thought of fatty liver, I really thought of a subset of a population, that this occurs to someone else, maybe more so the Hispanic population. This is a South Texas thing. It's a San Antonio Mexican food related thing. It's that there's a subset of a population that comes to mind, and I want people to understand that this can happen to anyone. This is not just our relationship with carbohydrates, our relationship with alcohol seems to be minimized all over the United States. As far as we go out on the weekends, or we go out a couple of times a week to eat. We have a drink or two. These are the yous and me's and everybody out there. Somebody sitting next to us could have fatty liver and not know that they have it. Meanwhile, they're thinking this happens to a certain population of people, and therefore I want people to understand that it's a wider range of people. It happened to me. It happened. I'm a doctor. I'm educated. I'm female, I'm Caucasian, and there's a whole, this can happen to anybody, and it's an enormous undertaking. I know Pinnacle, you guys have, you guys have worked on getting the word out for FibroScan, for patients to go and to get evaluated very quickly, very easily, painlessly for, fatty liver detection, because as you've mentioned, it is a multi-stage process. There's early detection. There's treatment all the way into, or not treatment, but there's detection all the way up to cirrhosis. But the treatments are lacking, and cirrhosis is not a beautiful disease to die from. It takes a very long time. It's very debilitating to the family, the person, the family, society. Very expensive. It's terrible to watch patients die from. So explain for us how can we begin to make a dent in this large problem?
Yeah, well, you said something very important and so true. Everyone is at risk. Now, there are differences between different populations. For example, in Asia, in India, in China, and those countries, it's very common to have something known as lean fatty liver. What that means is that you do not need to be overweight in order to have fatty liver disease. So that's one type of the disease, right? Here in the US, what is known is that the African American population is probably somewhat protected from fatty liver disease, although they have a higher incidence of diabetes, for example. The Hispanic population has the highest prevalence of fatty liver disease, followed closely by the Caucasian population. So this is something that, yes, there are differences, but anybody can be affected by fatty liver disease. So how do we make a dent? Well, number one, if you have any of these risk factors, if you are overweight, if your liver enzymes are elevated, if you have insulin resistance or type 2 diabetes, or the doctor tells you, yeah, you have hypertension and your cholesterol is high, you should get your liver checked, period. Now, the advantage of going to a center that specializes in fatty liver disease, such as Pinnacle and STRI, is that we don't only do this FibroScan, which is an awesome technology, kind of point-of-care technology that opens up and provides us with further information on how that liver may be. But whenever these results show that this patient in front of us is actually has some abnormalities on these results, then immediately we offer to do some more in-depth blood work, for example. And this is important because the blood work that we do is not the blood work that you will get at a normal clinic going to your doctor, is much more specialized into trying to identify more information. For example, fatty liver disease is often associated, is linked to other diseases in the liver or outside the liver. For example, autoimmune hepatitis There are patients that have fatty liver disease that also have autoimmune hepatitis. And the doctor may not be able to differentiate between the two and keeps treating this patient who is overweight as a fatty liver disease patient. Just, try to lose some weight and go home. The problem with this is that autoimmune hepatitis on top of fatty liver disease will make these patients develop cirrhosis much quicker than those that do not have both diseases at the same time affecting that liver. So differential diagnosis, right? That's very important. If you have autoimmune hepatitis, you can actually get treatment for it. You can cure, you can at least stop the progression of autoimmune hepatitis. So doing that will benefit these patients that have these elevated liver enzymes and so on. So that's one. Detect and diagnose your patient. What's going on in you? On top of that, we also check signs of kidney disease, signs of cardiac heart disease, and signs of insulin resistance, or even how bad the type 2 diabetes may be, or how well or badly controlled it is. So there's a lot that we can do for these patients. And when they are identified as this high-risk patient, that means that the patient has the disease and the patient is at risk of progression of the disease and at risk of getting into the world of cirrhosis that you just mentioned, and nobody wants that, like not the doctor, not the patient. So what can we do for these people? There's a lot that Pinnacle and STRI can offer to them.
Wonderful. So I want people to understand, if I could get any point across, I want people to understand when you go to your physician and you look at your health, you are looking at a whole picture. You're looking at these days, you're looking at a whole metabolic picture. We're not just concentrating on heart disease. We're not just concentrating on, evaluating for cancer, the potential for cancer, screening for cancer. We're not just looking at, Alzheimer's and dementia risks, your hormones this is a whole picture. All of these diseases belong together. They all interact together. They all come from the same place, and that's metabolic inflammation. Liver disease is a part of that chain. It's a part of that equation of the whole picture of inflammatory disease. So we need to focus as clinicians, I need to do a better job at talking to people about how I don't just want to focus on one organ and one disease process. I want to focus on the whole picture from a metabolic disease process, and have people realize that the liver is an enormous part of that. Your kidneys, your liver, your brain, your cardiovascular system, all of this is a large part of that. Fatty liver has the least amount of treatments available at the moment. We talk about lifestyle, right? So what does lifestyle, when we describe lifestyle to patients, what does lifestyle mean to people? What's the best way to describe to them how to approach that?
It is easy but complicated at the same time, and we'll probably talk about during 3 full shows about
exactly
lifestyle, right? But just quickly, what I can say is that it is recognized today that carbohydrates are the abuse of carbohydrates.
Yes.
This means sugars.
Yes.
Anything made with flour and sugary drinks and all this sort, bread, pastas, and so on. All of that is really, really bad for you.
It's so good.
Well, it is so good. I know desserts and everything. I am, I almost always, when I go out, I will order a dessert at the end. If I'm with someone, I will try to convince that someone to share the dessert so I don't eat it all by myself.
That's right.
It is actually pretty bad. So what can you do? Well, lifestyle modification, what I will suggest is go to a nutritionist or a dietitian to try to get more insight into this. I know that if you are told by the doctor, try to lose some weight, you cannot do that. You need, because we, the population in general, we are ignorant about what do I do, right? What do I do? Oh, just less calories. Well, it's not just about less calories. You need to balance your nutrition, your proteins, your fats, and a little bit of carbs and so on. When you are told that you have liver disease, you need to avoid alcohol. Like if you completely stop it, that's the best that you can do.
Right.
If you can completely stop it, well, then reduce it significantly, right? That's what you must do. During this lifestyle modification process, you will need to start exercising. And people that have obesity, I know how difficult it is. And I've been in the valley during the summer, and I know how difficult. If someone tells you, yeah, walk around, right. It's just not doable. But you need to exercise at least 30, 40 minutes per week. From nothing to that is already something good.
Exactly.
If you can do 20 minutes every day, even better, right? If you are committed, so commitment is step number one. You really need to want to lose that weight, because at the end, how do you measure if you are being successful? Is by losing weight. And how to lose this weight? Well, you have to reduce your carbohydrates and so on. And there are many studies comparing different diets. And for example, the Mediterranean diet is a good one, right? I know in the Valley, there's a lot of seafood and stuff like that. Well, not anything is good, and you have to stop eating or munching on the chips, right? You have to do that.
Right.
And you have to order something that has no sugar for drinking. And if you can do just plain water, right. That's the best. I've known people that tell me, hey, doctor, I just had my fruit punch this morning, but there's no problem because every fruit was completely natural. And I go, yeah, it's all sugar. That doesn't matter. It's all sugar. But that's how bad the education on how we need to change our nutrition is.
Absolutely. Dr. Duncker, we are up against our first break. I want to direct people over to pinnacleresearch.com to look at getting scheduled for their FibroScan, which we will talk about more in just a few minutes. Let's take a short break, and when we come back, let's open that up a little bit further. We'll be right back.
Fatty liver is linked to two different situations, alcohol and diabetes or obesity. In both cases, patients can have no symptoms. In the United States, and in particular, Texas, the most common cause of liver disease in general is non-alcoholic fatty liver. Again, associated with overweight, obesity, and or diabetes. Additional risk factors include high cholesterol, high blood pressure, Hispanic ethnicity, and postmenopausal status. At Pinnacle Clinical Research, we offer a quick, non-invasive ultrasound-based screening assessment called FibroScan. This test is done at no cost to you, and we do not take insurance. The test will measure the fat and stiffness in your liver and stage your risk and development of fatty liver disease. You will meet with a provider immediately following your scan to go over your results. If you're interested in getting more information on your liver health, please call 210-529-7978 and schedule your FibroScan today. We are conveniently located in the Medical Center at 5109 Medical Drive.
Welcome back, everybody. I'm Dr. Marianne Pinkston here with Dr. Carlos Duncker from Pinnacle Research. And we have been discussing fatty liver, and we discussed a little bit about lifestyle and changing up lifestyle, which I agree with you, would take a couple of shows to do. But I want to make sure that people understand and know how to get help for this, where to go, and how to open up their search for whether they have underlying liver disease or not. Pinnacle has a great technology called the FibroScan. Tell us, and also too, where can they go for treatment? You at Pinnacle are trying to develop some treatments and therapies. You have a lot of different research projects that are going on. And I know some people are afraid of entering into research. So tell us a little bit about Pinnacle and what you have to offer.
Sure. So Pinnacle and STRI in the Valley are running a lot of different clinical trials. Every different clinical trial will attend to different types of patients. Some of them require patients that have cirrhosis. Some others require patients that have advanced fibrosis. Some of them do not, and so on. So there is a lot, and every different trial has different, what we call inclusion and exclusion. So what must the patient have in order to qualify, and what cannot have in order to qualify, right? So once every patient is different, and once we identify the patient and we do these assessments that I was talking about, that may include the FibroScan and some blood testing, then we can offer the best clinical trial for that particular patient. Clinical research is changing, but a few years ago, some people would think that clinical research is not safe, or that it is dangerous, or you get some people saying, oh, I don't want to be a guinea pig. But you just mentioned earlier that these people that participate in clinical research actually are doing something for medical science. That's one. The medications that they are getting have already been proved for safety, so they are safe. Not all of these are new medications that want to come to market. Some of these are medications that have already been approved by the FDA, that are being used, and what clinical research is trying to see if a different dose is better than the one being used today, or if this medication can help you not only control the sugar in your blood, but also help you lose some weight, for example. Some others compare two different medications that are already in the market. So research is not like you see on TV doing research in guinea pigs, right? Also, what do patients get? Well, they get early access to potential medications. This access is free access to all these drugs that may cost a lot of money otherwise. You get an in-depth analysis of your disease by experts in fatty liver disease. And for the whole duration of the trial that you participate in, you get world-class follow-up and assessment of your liver continuously, like every month, every 3 months, depending on the trial. Some trials last for half a year, some others for 5 years. And most people receive some sort of compensation or stipend for the time that they dedicate to coming to the site, and for doing these visits every time that they come. So if you live in Austin, in Georgetown, in San Antonio North, San Antonio South, in Corpus Christi, in Edinburgh, or in Bronzeville, and we are also working with sister research sites in places like Houston, Dallas, and even outside of the state, and you or your family member or friends are overweight, have type 2 diabetes, or have been told that they have fatty liver, please do not procrastinate. Come to one of these locations to get your liver checked. Everything we do is free, no insurance, no out-of-pocket payments, ever. And you get a full assessment of that liver. And if we detect that something is not right, then it's a win-win for everybody.
It really is. So think about it. If you don't have insurance, you have access to like you said, world-class treatment for years. You may even get compensated. This is a huge thing that you are also doing, and value to give to humanity, because you are helping others that will come after you. You have a large amount of coverage in Texas for sure for being checked and being seen and taken care of. This is amazing. How do people get started? I've assured people to go to pinnacleresearch.com and start by getting signed up for the FibroScan, but what's the best way for people to get started?
Yeah, that's it. Either call or go to the website and contact us. You can just come in and we will see that you get a FibroScan any day, any moment. We usually also go to different clinics around town, offering this fibroscan for free at the clinics once a month, twice a month. We are present in many community events also, everywhere where we offer this technology for free, just because we know how important it is to tell people, right, you need to have that liver checked.
Absolutely. And a little bit about the scan. I went and had it done. It was very simple. I arrived and was ushered in very quickly. It was like an ultrasound of the right upper area of my stomach here. It was painless. There were no needles involved. Nothing frightening. Very quick, so you can get it done at lunch or in between, your errands somewhere, and just go to pinnacleresearch.com and sign up. Like you said, people can stop by. Is that something they can walk in and do?
Yes, they can. The only important thing is that they have to be fasting for at least 3 hours.
At least 3 hours.
Not right after lunch. It wouldn't work. If you had breakfast at 8 a.m., right, it means that you can come in at 11. That's fine.
That's great. So fast and free and very easily done. So please also go to my website at drpbetterlife.com. You can see the previous shows that I have with Dr. Duncker, Dr. Harrison, and Dr. Patil, all wonderful physicians that are associated with Pinnacle, and see some of the previous shows. But I also have links to Pinnacle as well, where you can get signed up. Dr. Duncker, it's been wonderful to have you on. Thank you so much. Very informative. And as always, an honor and a pleasure. Any final words?
It has been great. I hope that this helps some people at least understand the importance of this. And thank you for having me.
Absolutely. We've done a great job, I think. Thank you. And everybody have a wonderful week.